have a bit of a lack of urgency right now. There's plenty of vaccine available and people are just waiting until it's more convenient. We are adapting our efforts on how and where we vaccinate to try to meet these needs. We've got an increased focus on our younger populations, and we're going to places where we can reach them more easily. We've got continued focus on our historically marginalized populations and those most affected by COVID. We're working with Action NC to provide in-person outreach and education and to facilitate access to vaccination opportunities in those targeted communities. We're continuing with our educational campaign on all the different platforms that are available to us, and we'll continue these efforts with federal and state dollars as they become available to the department. In terms of the governor's executive order, which will be effective, a new one will come out effective April 30th, this Friday, through the end of May. What he has said to date, we have not seen the written order yet, but what he has said, masks will still be mandated indoors, but he will be dropping the outdoor mask mandate. Masks will still be strongly recommended outdoors by North Carolina Department of Health and Human Services in crowded areas and for higher risk settings where social distancing is difficult. And as you know, that is fairly consistent with the CDC guidance, although basically CDC said no masking for those who are fully vaccinated. In terms of mass gatherings, the number of people who may gather indoors will increase from 50 to 100, and the number of people who may gather outdoors will increase from 100 to 200. Occupancy limits will remain the same as they have been up to this point. We'll likely see further restrictions lessened on June 1st, but we'll have to wait and see what numbers look like moving forward. The main point I want to make here is if we are to continue moving towards more openings and less restrictions, we need everyone to do their part. We need everyone to get vaccinated. If you need more information about vaccines, please talk with your healthcare provider or visit our website or call our hotline to get your questions answered. We don't need people to wait. We just need them to vaccinate. So with that, I'll turn it over to Dr. Sullivan.
Thank you, Gibby. As Gibby said, I'm going to just provide a brief update about vaccinations for Mecklenburg County Public Health and really just provide a few more specifics about the important points that she just made. The first is just echoing her comments that we are very happy to hear the recommendation by the Advisory Committee on Immunization Practices and the CDC and FDA to lift the pause on the administration of the Johnson & Johnson vaccine due to the known benefits of the vaccine strongly outweighing the risks, and we began administering the vaccine again this week. I also want to stress again that the pause served to highlight and reinforce the significant emphasis on safety throughout the entire vaccination pre-authorization and post-authorization monitoring process, and we remain committed to providing all appropriate clinical counseling to individuals prior to administering any vaccine, and providing transparent, non-judgmental, factual information and answers to individuals' questions and concerns. And we continue to have full confidence that we have 3 safe and effective vaccines that are available, and again, are trying to get people vaccinated as quickly as possible. We also are working hard to provide ongoing first and second doses of the COVID vaccine at our fixed sites through our community events and through our homebound vaccination program. And in accordance with our vaccine equity plan, one of our very specific focuses right now is vaccinating residents who have ongoing challenges to accessing the vaccine and or have been disproportionately impacted by COVID. So just a few specifics on some of these efforts include our homebound vaccination program, for which we have vaccinated over 200 residents in the past few weeks through partnership with Mecklenburg County Public Health staff, medic, emergency management, and our EMTs and paramedics through our city, county, and town fire departments. We are working hard to schedule vaccinations for the remaining residents who have submitted homebound vaccination requests, and also partnering with many community organizations to conduct outreach and identify eligible residents in the community who have not yet been vaccinated. At this time, we are also offering the vaccine to caregivers and other household members of homebound residents at the time of the vaccination appointment. And we'll say I'm very proud of what our staff have been able to accomplish through this program to date, and we really want to encourage eligible individuals who have not yet submitted a request to be vaccinated to contact us either through our hotline or through our website. We also have been reaching out and working directly with long-term care facilities and other facilities to identify residents and or staff who are in need of a first or second dose of vaccine to assist with these vaccinations, and we'll continue to do that. And then finally, we are continuing to have several targeted vaccination events each week in locations that serve populations disproportionately impacted by COVID. We have been using census tract data and vaccine uptake data to identify additional needs for vaccine outreach and access points or events, and are working really closely with our hospital partners, with StarMed, and with other enrolled providers to collaborate on a coordinated approach to continue to ensure equitable access to the vaccine throughout the entire county. And finally, I just want to highlight again a few specifics about our ongoing work to plan events and ensure opportunities for vaccination at non-traditional locations, with an emphasis on also offering convenient opportunities for vaccination for individuals who have not yet taken the time to go to a vaccination site. So a few upcoming highlights: we are partnering with the Alter Egos Motorcycle Club to hold an event at our Beatties Ford Health Department location on this Saturday, May 1st, partnering with the Faith CME Church in the Hidden Valley neighborhood on Wednesday, May 5th, with the Catawba Brewing Company on next Friday, May 7th, with Black Food Truck Friday, also next Friday, May 7th, and returning to Camp North End, on Saturday, May 8th. We will be offering both appointments and walk-in slots for first or second doses at all of these, and we'll have multiple vaccines available, including either the Pfizer or Moderna vaccine and the Johnson & Johnson vaccine based on the vaccine recipient's request. And I will stop there and be open for any questions.
Thank you, Dr. Sullivan. First question today is Vanessa Rufus, WCNC.
Hi, good afternoon, everyone, and thanks for taking my question. I wanted to see if we could address a couple of common comments that we see from people who are more on the vaccine hesitant side. One is a concern over the emergency use approval and basically wanting to wait for full approval. And I guess I was curious about, what factors are standing in the way of the full approval. Is this more safety data that we're waiting for, or is this more efficacy stuff waiting for like a certain period of time to pass before we get to that full approval stage? And then I have a second point, but I'll start there.
Yeah, so I can answer that first question. I think I definitely understand those questions around the difference between emergency use authorization and kind of full approval, and really encourage individuals to ask those questions, and as Gibby said, to reach out to their healthcare provider, to the hotline, to talk that through. So we know the emergency use authorization, right, still requires a significant series of steps that have to be followed. We talk about the significant clinical trial data, the extensive review, and then ongoing post-approval or authorization monitoring that occurs. But because we are in a pandemic and in this emergency use, it again is a little bit of a faster process for that approval. So that significant review that happens is expedited and allows that authorization to occur first. For full approval to occur, they do require at least 6 months of post-clinical trial data, which actually Pfizer and Moderna have now. And we've heard about that data and continue to see that safe and effective data and real-world effectiveness. So it is something they could apply for, but the process and the review process for approval is not as expedited, so it does take a while. One of the other concerns is once a vaccine, the emergency use authorization is dependent on the fact that there are no other alternatives that are fully approved available. So once vaccines become fully approved, then that might inhibit other vaccines that we know are still in the pipeline from getting emergency use authorization. And again, we know that we are very fortunate right now to have significant vaccine supply, but we still have a lot more people to vaccinate. There are still a lot of vaccines that are under clinical trials. And as we look at, what's going to come for children, for other populations, and then globally. And so I think that's another factor that's coming into play there as well.
Thank you for that response. And then, so my second point is also a comment that we hear from folks frequently who are on the hesitant side, and it's more of a comment about being unsure what the long-term impacts or effects might be from these vaccines. And it made me think about something that I had seen where a particular doctor was saying that most adverse impacts from vaccines actually happen in a relatively short period of time, like for example, like 2 months or something like that. And I didn't know if that was an accurate statement that you were familiar with, and if you had anything else to shed some light on that particular comment.
Thank you again for that question and for that point. I think that is accurate, correct. And I think the reason, when the FDA was making the determination about how the process they were going to use for emergency use authorization, for the initial first Pfizer and then Moderna and now Johnson & Johnson vaccine, they came out and said that they were going to require at least 2 months of post-clinical trial ending safety data before doing it. And it's exactly for that reason that when we think about severe adverse reactions, first, we know that they are very rare, right? And the safety data is overwhelmingly strong to show the millions and millions of doses that have been administered and versus the number of adverse events. But yeah, the majority of them are seen within a couple months after receiving the vaccine. And so I think when we talk about, long-term effects, I think we can confidently say what we know about, decades and decades and decades of research on vaccines, what we know about these vaccines, that they are safe, they are effective, and we really are encouraging people to get vaccinated.
Next question is Hunter Science, WCNC.
Hi there, Gibby. I have a question about the mask mandate being rolled back tomorrow. If it were up to you, would you be doing the same? And are you concerned that as our numbers start and continue to slowly go up here in Mecklenburg County, are you afraid that this is something that should not be happening?
That's a good question, and one that we will watch very closely as this rolls out. But I have to say that people being outside, and especially if they're not in large gatherings, it's probably safe for them. And as we see more people vaccinated in our community, the move in that direction is probably safe. I think the other thing that I have to recognize, we've got to be reasonable about this. As the weather continues the temperature continues to go up in our community, and we start seeing more humidity in our community, even if we had the mask mandate in place, I think we'd have problems with people wearing masks for very long when they're outside for any period of time. So this is a reasonable approach. It's a beginning for us to take an opportunity to reduce some of the restrictions, especially around masking outside, and we'll watch it very closely over the next month and see what kind of impact that it has. I think of all the things that the governor could do, this is probably one of the more reasonable ones. We're looking forward to people having a little more freedom and hopefully complying with the other things that we know really will have a strong impact, which is wearing that mask inside, continuing to do social distancing and avoid the crowds that we want them to stay out of. So I think it's probably a reasonable first step. And as always, we'll continue to watch these numbers and see what happens. Everybody has their fingers crossed that it will not have any kind of negative impact on our numbers.
Sullivan, quick question for you. Has there been any communication between the county health department and any of our, like the Hornets or the Panthers or the Knights to hold a vaccine clinic during a game to try to get people to get vaccinated while they're going to a sports game?
We've had conversations about those locations being opportunities. I don't know that anybody has had specific conversations, although either one of our healthcare systems who work with some of those venues to provide the emergency support during their events and stuff like that may be having those conversations at this point. So again, we're looking at every possible venue where we might be able to be available to people and make the vaccine just as accessible and convenient as possible.
Next question is Allison Kuznets, Charlotte Observer. Allison Kuznets, you're up. Okay, Allison, we'll come back to you. Next question, Chloe Leshner, WCNC.
Hi, everybody. Just wondering, with demand going down and kind of rolling back some of these mask mandates outdoors, there's talk of, with not as many people wanting to get vaccinated, if we don't reach herd immunity, what does that mean for masks indoors? Is that going to keep them around much longer, do you think?
Well, obviously, the need for people to wear masks indoors exists right now. We still have a lot of virus in our community. We're still seeing our numbers staying above the level where we would be very comfortable with them. So we know that the mask indoors is really important at this point in time. The things, as I mentioned before, the things that are going to help us move out of that and into situations that are less restrictive is people getting vaccinated and continuing to social distance and wear masks at this point. So if we will have to watch and see how this happens. I don't anticipate the mask mandate indoors being lifted soon. I think our numbers are still high enough at this point where that needs to be in place. And again, we just need people to step up. I think I want to be clear too, though, I mentioned this earlier, is I don't believe the only reason people are not stepping up to be vaccinated is because they don't want to. I think there's the hesitancy there. People just need more education, more opportunity to ask their questions. But we do have that issue of just whether it's convenient or not. If there's plenty of vaccine out there and somebody hears about a clinic and it's easy to stop by and get vaccinated, I think there's still plenty of people out there that are willing to be vaccinated. They just haven't had the opportunity that's right for them at this point.
A quick follow-up, if I can. Do you have any concerns, though, about herd immunity, not being reached anytime soon?
We continue to stay positive. Our percentage rates continue to go up a little bit every day. So that means we're getting some people vaccinated. And the hope is, as we shift our processes in our locations and the way we make ourselves available to the community, that those numbers will continue to go up. So we're staying focused on herd immunity at this point. Going to be positive about this. I trust our community.
Let's circle back to Allison Kuznets. Allison Kuznets, were you able to get your mic open?
Hey, this is Hannah Smoot. Allison's mic still isn't working,
Okay.
so she sent me her question. Her question was actually very similar about if you have concerns that we won't reach herd immunity. So you've sort of touched on that, but can you expand on that a little bit? And do you have any estimated timeline for when we could reach herd immunity?
Don't really have an estimated timeline right now. I think, we've seen a shift in the numbers coming in to be vaccinated over the next week or two. And as we start providing vaccine in a different way, different locations, we'll have to watch over the next 2 to 3 weeks to see what kind of effect that has on the numbers that are being vaccinated. But, I am hopeful that as we move into the summer and as vaccines become available to 12 to 15-year-olds, we're going to see more people coming in for vaccine. And as people begin to see the opportunity to do more things if they're fully vaccinated, I think that will serve as a incentive to get vaccinated as well. So I don't know that we're going to meet a June 1 deadline for getting to 2/3 of our population. I'd love to think that we could. I'm not sure that we will. I think it'll be later in the summer before we reach that here in Mecklenburg County.
Let's circle back to Vanessa Rufus, who has another question.
Pretty good transition here because it's kind of along the lines of what I wanted to ask about. So I've been tracking the past few weeks of total vaccinations done in North Carolina, and I see that the last 2 weeks we've had kind of a drop down, and last week was even fewer than the week before. So I'm curious to know what you're seeing this week. Are you seeing this week's even fewer than what you were doing at this time last week? Or do you think that the last 2 weeks we're kind of seeing what the new demand is? Or do you think it's going to continue to drop as we go forward?
All right.
Yeah, I think it's a good question. I think the first thing to say is we've obviously also been watching that data closely, and I can really honestly say that it is not for a lack of availability of vaccine in our community, not for a lack of our community partners, our enrolled providers providing, trying to go to as many places as possible to provide vaccine, and that there still continues to be lots of vaccine available in our community. So I think we are hopeful, as Gibby said, and remaining positive that there's a lot of people out there that still need to be vaccinated, and we're trying to be as creative and innovative as possible to provide that. This week, I would say, just anecdotally, what we're seeing at our clinics is relatively similar to last week. I think we, again, being able to bring back the Johnson & Johnson vaccine and offer people options with kind of the relevant clinical counseling, I think has been helpful. And we're hopeful that that will help going forward and something that we plan to do going forward. But I also think, right, we're going to just continue trying, whether it is through expanding our homebound program, through working with organizations, through going to different, more creative or non-traditional places, that we see that demand go up. But I think it's too soon to tell right now.
Next question is Caroline Hicks, WBTV.
Hi, thank you for taking my question. Can you talk a little bit about the strategy behind closing the site at Bojangles Coliseum and then allowing StarMed to open another location, and just kind of what closing that site will allow you guys to do instead?
Go ahead, Meg.
Okay, sorry. I think that was obviously something that we talked a lot about, and again, are just incredibly proud of the site that was set up at Bojangles and the amount of vaccines that were given and the process that was put in place. But I think, we've always at the health department really seen our role as helping to collaborate and work very closely with all of our community partners and enrolled providers to be able to provide vaccine. And especially over the last couple of months, we have seen a significant increase in the number of enrolled providers, the number of providers that are receiving vaccine on a regular basis, and the number of sites around the community. The second thing is, from the very beginning, we developed our vaccine equity plan and have really been focused from the beginning on serving those populations most disproportionately impacted and having the biggest challenges to accessing the vaccine. And I think that's really where our efforts continue to be focused, especially as more vaccine sites become available. The need for Bojangles in the community is just less. StarMed has been a wonderful partner, and working with them at the Bojangles site has worked really well. But as we made that decision to close that site because of the widespread availability, they also did want to provide an option for individuals in nearby who for whom Bojangles was convenient, and so we'll be opening up some appointments at a nearby location. That was done in collaboration and partnership. We work closely with all our enrolled providers to make sure there's vaccine available everywhere. But again, our focus is really on our vaccine equity plan and looking to those that are having the biggest challenges accessing vaccine.
Next question, Brett Jensen, WBT Radio.
Hi, I'm curious, going back to this whole herd immunity thing in June 1st and all that, I started crunching some numbers, and for us as a state to hit the 66% of at least partially vaccinated, that means roughly about 5.5 million of those eligible will have to get vaccinated. 5.5 million people of North Carolina. If that number drops down to 12-year-olds and 13 and 14-year-olds, then now we're looking at about 6.5 million people that are going to have to get fully vaccinated just to meet the criteria, or 6 million people just to meet the criteria. And right now we're roughly at about 4 million people. So, 2 million people by beginning of June 1st, that doesn't seem plausible. But to that end, are you guys seeing the hysteria from the Johnson & Johnson finally going away, or is there still a lingering effect from that?
So I think thank you to just address your first point, which I think is an important one. Yes, we still have a lot of work to do, and I think we recognize that. We have the vaccine supply and we have the provider capacity right now to provide a lot of vaccines in the community, and so it's really about finding individuals, really encouraging them to show up to vaccination sites, to get vaccinated, to reach out to us with questions and concerns, so that we can get closer to that number. Johnson & Johnson, it's only been a few days. I think we are still definitely encountering individuals who prefer right now to get Pfizer or Moderna, or individuals that still have ongoing questions or concerns. And I just want to, again, recognize that the last couple of weeks, there's been a lot of information that was posted around Johnson & Johnson, some of it accurate, some of it not. And so I think taking the time to ask questions if people do have concerns about it, to, again, as Gibby said, call our hotline. They show up at a vaccine event and they're not sure which vaccine is right for them, to talk to one of the providers about it. Because I think that's how we're going to continue to reinforce that we have 3 safe and effective vaccines and make people more comfortable with their options.
Next question, we're going to circle back to Hannah Smoot, Charlotte Observer.
Hey there, thank you. Gibby, you had told commissioners that public health has received vaccination data by zip code. When is that going to be released, and what does that data show? Can you give us a brief overview?
Well, some of the data, I believe, is going to be in our data report that will come out tomorrow. We've also just recently received some additional data at the census tract level, and but it came in a very raw form, and it's lots of data, and it's taken a little while to analyze that. But I do believe there'll be a little bit about the zip code data in the report tomorrow. What we're seeing is pretty much what we expected. It's not that different from the other maps that you've seen about where we're seeing issues with COVID in our community, where the areas that are most affected. Those aren't necessarily the areas where most of the vaccines are being given. So it just reinforces the fact that we've got certain populations that are underrepresented in the vaccines that have been given up to the state, and that we need to continue to focus on that and making sure that we're making those vaccines available in those areas. So hopefully that will come out in the report tomorrow, and then we'll be happy to have more discussion about it once that's finalized.
I have another kind of data point question. Throughout this pandemic, it's kind of a lessons learned question. Throughout this pandemic, we have kind of seen a little bit of disorganization in the collaboration of data between different entities. And I'm just wondering, what are your thoughts on what could better that, as far as like really getting a good number of how many people in the county have been vaccinated? And is it even possible to do it by zip code, like COVID positive cases?
That's a good question, and that has been an ongoing and evolving situation, and it is still an evolving situation. The part of the challenge around this has been the evolution of systems to track this data. And in North Carolina, our state has decided to require that we use brand new state systems that they are in the process of developing as we're trying to use them to collect data. And then as they're developing those systems, they have limited ability to pull data out of those systems. So there have been times when we've gotten a little bit ahead of them, and then once they've come along behind us, we're seeing that the data is not always matching up exactly right. We've had to work through those things, and then trying to make sure that we're using a centralized system to do this so that we're not showing different data to the community, which is always confusing. And now we're seeing the same thing with vaccines. We have a state system that was created just for this purpose and is continuing to be improved and changed, and now we're just now starting to get good solid data out of that system that allows us to really understand what's happening on the ground in Mecklenburg County. The data we've gotten up to this point has been fairly general. So, you know, the solution to this, Hunter, is that as we move through this pandemic, that we actually spend time and maybe some of the resources that are coming from the federal government to better automate and come up with systems that can be used moving forward that will allow all of us to have the data we need and the consistent data that we need to communicate to our communities what's going on. So hopefully we'll learn from this, and we'll be able to use some of the resources that are coming down to create those systems for future use and to improve what we're doing right now.
I promise this is my last question, Gibby. But I do want to ask something that I don't think you guys probably get asked enough. But how are you doing? How is your team doing? It's now a year and a half we're going on here, if memory serves me right. What keeps y'all going?
The needs of our community, and the fact that that's what we're here for, is to serve the community and try to prevent disease and promote health in our community. That's what public health does. And our staff is incredibly committed to that and has shown that commitment over the past year and months. We are still working hard. We are having internal conversations because we are starting to receive more funding from the federal government about how we might, quote unquote, normalize COVID within our department, bringing in some additional resources so that staff can actually get back to some of the other work that they were hired to do. while we're continuing with our COVID response. So we are, we look for ways to support our staff, but I will tell you that they have been worked hard this past year, and they've stepped up to the plate, and they're continuing to work hard. And we all support each other, and we look for ways to give people breaks when they need it. Probably not enough, but we're trying to be better at that as we move into the second year of this pandemic.